Minister, sorry, we've got an audio problem.
All good? Yeah, sure.
Sorry, guys.
It's so good, I'm happy to talk about it again.
What's happening
And
here?
it's just starting to rain.
Sorry, guys, can you just hold this, thanks?
All good? Yeah.
Why not the audio? I've seen audio before. One, two, 1, 2. 1, 2, 1, 2, 1, 2. Now we're getting audio. Must have been that thing. Oh, sorry about that.
You're starting again?
Yeah, thank you. When you're ready.
Well, it's wonderful to be here in Cairns with Minister Crawford, and we are celebrating the Palaszczuk government's historic budget, and particularly our investment of over $23.6 billion in operational funding for health. And in addition to that, another $9.785 billion in capital investment between now and 2028. So the next 6 years, we will be bringing online 2,509 beds here in Cairns, and I'm here with the Chief Executive, Tina Chenery, and also our Board Chair, Clive Scarrett. And we are celebrating over $1 billion in operational budget, but importantly, we are seeing an investment of $250 million to bring another 141 beds online. Now, the first stage of that is 45 beds that will be operational by the second half of next year, and these beds will be off-site. So these are subacute and aged care long-stay patients who we will assist in having them cared for elsewhere so that we can free up those 45 beds in the hospital. We'll also have a huge new surgical centre, which is really exciting, the investment that's going into this new hospital. I do want to just take a moment. Tina Chenery, who's our Chief Executive for Cairns and Hinterland Hospital and Health Service, is moving on, sadly, and I want to acknowledge her tremendous effort in this local area, her investment, her innovation, and she certainly leaves behind a great legacy of investment and growth in the hospital system here. I'll ask Craig to say a few words, and then we'll ask Tina to say a few words. Thanks.
Thanks, Yvette. Good morning. Look, this obviously announcement in this year's budget about the Cairns Hospital is significant, not just for Cairns, but for the entire region of the Cape, of the Gulf, of the enormous area that this hospital draws patients in from. So those beds that the Health Minister has announced, the ones coming online next year and then further beyond that, will make a big difference. It'll make a big difference also to our hard-working paramedics and our hard-working medical staff in the hospital as well. As Cairns comes out of COVID, we're going to see more tourists in this town. We're going to see more activity, and we will obviously see more demand on our health services. So our budget has reflected that. I'm very proud to represent Far North Queensland in a cabinet that has delivered an outstanding budget for health.
Just thank you very much, Minister, for those very kind words. But can I really thank our community? Our community has been absolutely fantastic in following the health advice, and we really appreciate it. I also want to acknowledge our amazing and hard-working staff, our cleaners, our admin, our nurses, doctors and allied health. We are very pleased, and I am very pleased with the budget outcome. It's a nearly $1.2 billion of operating budget. That is absolutely fantastic, and that includes the funding to operate those 45 new subacute beds, and we will commission them as quickly as possible. And included in the wonderful announcement has been the $250 million for capital investment for our stage 1 to expand our Cairns Hospital, and that's a new surgical centre, and that will help us improve in our elective surgery wait times. We know that for the people in the community, it's really important that they get their surgery. So a great outcome, and very pleased that the region has received such a good outcome from the budget. Thank you.
What's important to understand is this budget doesn't just concentrate on our big hospitals like here in Cairns. It also is making sure that we have an investment pipeline in our regional and remote towns. And in our first tranche of stage 2, which is going to be starting commencement very, very soon and be built by 24-25, we will have new facilities at Moranbah, Bamaga, Cow Bay, and I know the Mayor has lobbied me for that one, Tara, Pumperau and Normanton. So all of those new facilities will be built by 2024-25, and we know that will also take pressure off our major hospitals, but it's also delivering state-of-the-art health facilities in our communities and providing those state-of-the-art health facilities for our workers to work in, and importantly help us attract and retain health workers going forward. In addition, $1.6 billion in mental health. So we talk about this record budget. On top of the 2,509 beds, we have another more than 390 beds coming online and another 1,400 staff in the mental health space, and a $1.6 billion budget, which is so crucial because we know mental health is a growing concern. We know it puts pressure on our EDs and our hospitals, and this investment's going to make all the difference.
Minister, last week in the budget, these 45 beds that are part of this lease agreement, it was supposed to be coming online within 12 months. Why has that been pushed back another 6 months?
Oh, look, these negotiations take time. I mean, I will say this. These are long-stay patients who do not need medical care. This was a Commonwealth responsibility. For years now, we have been talking about people who need disability packages and aged care support in the community taking up hospital beds. Today we have over 500 long-stay patients in our hospitals. And so we are stepping into a space that traditionally is the Commonwealth's responsibility, but we're doing it because we know it's the right thing to do for the patients and their families, but it also frees up beds, and we can't wait any longer. But I do welcome the announcement of the new Albanese federal government, who has said they're going to put nurses in aged care, because between 2018-19 and now, we had a 55% increase of aged care residents being transferred to hospital via ambulance, a 55% increase, and over 1 year we had 41,000 transfers. So we know that's going to make a difference. I know Bill Shorten's announced that they'll have a team of people looking at getting disability support for those in our hospitals. So all of that will make a difference and take pressure off our hospitals.
We've seen over the last 6 months that across all the Far North hospital services, there's been at least 5 people that have waited more than 6 hours for an ambulance. Can we really wait more than 12 months for support?
Well, no, there's no such thing as a quick fix when you're seeing a whole lot of complex issues. There's not one thing that's caused this pressure. What we do know, though, is that COVID, the pandemic, has put added pressure on our system, that as at today, we are almost at the peak that we saw in our second wave. So we are in the middle of wave 3 right now. Over 500 beds today are being taken up across the hospital system with COVID. But we have an ageing population. We have the lowest take-up of private health that this state has seen in decades. And people who do have private health are still using our hospitals. We have increased chronic, complex health conditions. But importantly, we know people can't get in to see their GPs. GPs either have their books closed or you're waiting weeks to get in to see a GP. Where do those people go if they need health care? They're turning up at our hospitals. So we can only do so much to deal with the demand. We can increase our workforce, we can build new beds, and we can provide the funding, but we don't control those demand factors that are in the primary and allied healthcare sector, and that's why I'm going to Canberra this week to talk to the health ministers across the country about what else we can do with the Commonwealth to ease some of those pressures.
Minister, I'm speaking to a woman who has a large cyst on her ovary and an endometrial polyp. She has presented to the emergency department at the Cairns Hospital in severe pain. The hospital is well aware of her situation. She has been told that she desperately needs surgery, but to not even expect a phone call for 3 months.
Well,
How is that okay?
look, I can't talk about an individual case. You're putting something to me now that I have no information on. I'm happy to follow that up, and I'm sure Tina would be happy to follow up on that particular incident. But I'm not going to talk about people's individual cases. But
What about elective surgery? Clearly there's an
elective
issue.
surgery across this country was suspended. It was a national cabinet decision to suspend elective surgery in 2020, and then we had suspensions of elective surgery at certain times throughout COVID, including when we had the Omicron wave hit at the start of 2021. This has caused significant delays in our planned care. That's why we're building 2,509 new beds, because we need to make sure that we've got the bed capacity to do that planned care. Because when we did do that catch-up in 2020, that led to us taking up all of the spare bed capacity, in which there's not much generally, but what spare bed capacity we had in our hospital system was taken up by catching up with that delayed planned care. And that meant we had no beds free for when emergencies come in. 30% of our presentations at ED in any given day end up being admitted to hospital. 30%. So we have to find beds for those people. So we either delay planned care so that people who are being raced in for emergency can get that surgery and get that bed and get admitted quickly, or we delay people coming through ED. They're not easy choices, and that's why we're making the investment we are. But I want to be clear, we've also made the investment over the last 7 years. We've had 13,000 extra health workers put on. We've bought 1,350 beds online. The one thing we couldn't control and predict was a global health pandemic. We also don't control whether people take up private health. We don't control the GP sector. All of these things that we have no control over is putting immense pressure on our health system, and that's why this has to be a national conversation, and there has to be solutions at a Commonwealth level as well as the state to address these demands.
You mentioned going to Canberra this week. Will you be discussing the urgent care clinic that was committed in the federal budget?
Absolutely. So we will be getting a briefing from the new Health Minister, Mark Butler, about their election commitments. And when they're proposing those election commitments to be delivered. As I say, I'm really keen to hear on these clinics, but I'm also keen to hear when the nurses in aged care will happen, because I know that's going to make a difference. I know that if we have, less presentations from our aged care into our hospitals, that they will take pressure off our EDs and our hospital beds. So really keen to hear from the Commonwealth the timing of those election commitments.
Minister, what conversations have you had with the GP organisations in regards to filling the gaps within funding?
Yeah, so I've been meeting with a number of the stakeholders. There's an alliance group that's been set up, made up of the Royal Australian College of GPs and also the AMA and other stakeholders, that we are working through these issues. I know one of the big barriers is that Medicare has been frozen for many years for our GPs. It is not financially sustainable for GPs to go into practice on their own anymore. The days of having a family doctor are long gone. You can't get continuity of care, and it is very, very difficult for us to keep GPs and attract GPs in our regions. And I was hearing, Clive was telling me, I think it's 7 GPs that have ceased in this area. That makes a huge difference on people being able to get in and see doctors. So we're working with them. The Commonwealth, when National Cabinet met a week or so ago, announced $1 billion to review Medicare. And I welcome that $1 billion, because we do need a review of Medicare. We need to make sure that GPs can be financially stable to set up practice and to also provide the time they need to manage their patients. So it is a really important conversation. I welcome the input from all the stakeholders, the AMAQ and also the Royal Australian College of GPs, on how we can support them in growing our own. So I want more medical placements. I know Mark Butler, I think, said yesterday that there's more medical placements going to JCU, which is great. I want that for Central Queensland as well. We've actually had placements taken off us by the previous Commonwealth Government over the last 9 years, and they've gone to regional New South Wales. That's not good enough. I want those placements back, and I want it increased even more so we can grow our own doctors.
good. Sorted.
Thanks,
Thank you,
everyone.
Melissa.